Chapter 17. The Endocrine System. Let's review the endocrine system. Let's take a moment to discuss the role of endocrine cells beyond the major organs of the endocrine system. In addition to these key organs, endocrine cells are found in tissues all over the body. These specialized cells play a crucial role by secreting hormones, which are chemical messengers that regulate numerous bodily functions. These hormones have a specific job. They travel through the bloodstream and bind to target cells that have receptors designed specifically for them. This interaction triggers a response within the cell, ensuring the body maintains balance and responds appropriately to changes in the environment. In essence, endocrine cells work like a well-coordinated messaging system, sending signals to keep our body functioning smoothly. This slide lists the major endocrine organs, including hypothalamus, pituitary gland, pineal gland, thyroid gland, parathyroid glands, thymus gland, adrenal gland, pancreas, testes, and ovaries. Let's identify the major organs of the endocrine system using the figure provided. At the base of the brain, you'll find the hypothalamus and the pituitary gland. These structures act as the central control for many endocrine functions. Moving downward, the thyroid gland is located in the neck, just below the larynx, and the parathyroid glands are found on its posterior surface. Next, in the chest, the thymus gland is positioned behind the sternum. This gland plays an essential role in immune function, especially during childhood. The adrenal glands sit atop the kidneys, while the pancreas is nestled in the abdomen, near the stomach, serving dual roles in digestion and hormone production. In the lower body, the reproductive organs, the testes in males and the ovaries in females, also function as endocrine glands, producing sex hormones. Each of these organs works together to regulate vital processes such as growth, metabolism, stress responses, and reproduction. Let's dive into the important roles of the hypothalamus, pituitary, and pineal glands while referring to their locations in the figure. The hypothalamus, located at the base of the brain, produces 8 crucial hormones. 6 of these regulate the hormone production of the anterior pituitary gland, while the remaining 2, oxytocin and antidiuretic hormone, are stored in the posterior pituitary gland for release. The pituitary gland, often called the master gland, is situated just below the hypothalamus. It controls various endocrine functions by releasing hormones that influence other glands and tissues in the body. The pineal gland, a small structure located in the brain, secretes serotonin during daylight hours and melatonin at night. These hormones help regulate sleep-wake cycles and mood. Each of these glands plays a vital role in maintaining the body's homeostasis by producing and regulating hormones that affect growth, reproduction, metabolism, and other key processes. Refer to the figure to locate these essential structures and better understand their placement and relationship to one another. Let's break down some essential medical terms associated with the endocrine system. Mastery of these terms is vital for understanding the system's functions. First, endocrine means to secrete within. It refers to glands that produce internal secretions. Endocrinology is the branch of medicine that focuses on the endocrine system and the effects of hormones. It's the study of how hormones influence our body's processes. The term hormone originates from a word meaning to set in motion. It represents the chemical messengers produced by endocrine glands. The adjective form, hormonal, means pertaining to hormones. And finally, hormones are the actual internal secretions created by endocrine glands and other structures, setting various bodily functions into motion. Let's focus on the hormones produced by the pituitary gland, often called the master gland of the endocrine system. Using the image, we can clearly identify the hormones secreted by the 2 distinct parts of the pituitary gland, the anterior and posterior lobes. The anterior pituitary produces several critical hormones. Growth hormone, or GH, adrenocorticotropic hormone, or ACD, thyroid stimulating hormone, or TSH, prolactin, or PRL, follicle stimulating hormone, or FSH, luteinizing hormone, or LH. The posterior pituitary, while not producing hormones itself, stores and releases two hormones made in the hypothalamus: oxytocin, antidiuretic hormone, or ADH. The image is a valuable tool to visualize these hormones and their distinct roles in the body's regulation. The anterior pituitary, also called the adrenal hypophysis, plays a central role in regulating various bodily functions through hormone production. The anterior pituitary produces several critical hormones. Growth hormone, or GH, promotes growth and development of tissues and bones. Adrenocorticotropic hormone, or ACTH, stimulates the adrenal glands to release cortisol. Thyroid stimulating hormone, or TSH, regulates the thyroid gland's hormone production. Prolactin, or PRL, stimulates milk production in lactating women. Follicle stimulating hormone, or FSH, affects reproductive processes. Luteinizing hormone, or LH, also essential for reproduction. These hormones play essential roles in reproduction, growth, metabolism, and stress response, making the anterior pituitary a vital component of the endocrine system. Understanding the nuances of related terms is key to mastering medical terminology. Let's explore some important comparisons. Adenohypophysis versus neurohypophysis. Both are parts of the pituitary gland, but they serve distinct functions. The adenohypophysis is the anterior lobe responsible for producing its own hormones, while the neurohypophysis, or posterior lobe, stores and releases hormones made by the hypothalamus. Corticosteroid versus corticotropin. These terms are linked to cortisone. Corticosteroid refers to a hormone produced by the adrenal cortex, whereas corticotropin is a pituitary hormone that stimulates the adrenal cortex to release corticosteroids. Tropic versus tropin. The adjective tropic describes something related to hormones that stimulate production in other glands. For example, tropic hormones act on target glands. On the other hand, tropin is a noun, referring to those specific stimulating hormones themselves. By understanding these terms and their relationships, you build a solid foundation for mastering endocrinology. The thyroid gland, a vital part of the endocrine system, is located just below the Adam's apple. It consists of two soft, vascular lobes connected by a thin bridge of tissue called the isthmus. The thyroid produces three essential hormones: thyroxine, triiodothyronine, and calcitonin. Collectively, thyroxine and triiodothyronine are referred to as thyroid hormones, and they play critical roles in the body. Thyroxine and triiodothyronine stimulate tissues to produce proteins, increase oxygen use by cells, and regulate the body's metabolic rate. Calcitonin promotes calcium storage in the bones and supports bone growth, helping maintain healthy skeletal function. The thyroid gland's balanced production of these hormones is essential for overall health and metabolic stability. As students of medical terminology, fluency in the use of abbreviations is essential for clear and accurate communication. Let's focus on two key abbreviations related to the thyroid gland: T3, which stands for triiodothyronine; T4, which refers to thyroxine. Both of these are collectively known as thyroid hormones, and they play crucial roles in regulating the body's metabolism, energy production, and protein synth. Remember, understanding and using these abbreviations correctly ensures effective communication in clinical settings. The parathyroid glands are four small structures located on the posterior surface of the thyroid gland. Take a moment to observe the figure to visualize their exact location. These glands secrete parathyroid hormone, or PTH, a vital hormone that functions to raise blood calcium levels by stimulating bone resorption, increasing calcium absorption in the intestines, and reducing calcium excretion by the kidneys. Now, why are PTH and calcitonin considered antagonists? It's because they perform opposite functions. PTH increases blood calcium levels. Calcitonin, produced by the thyroid, decreases blood calcium levels by promoting bone deposition. Together, these hormones work to maintain a delicate balance of calcium in the body, critical for proper nerve function, muscle contraction, and bone health. The thymus gland is a small but critical organ located in the mediastinum, the central region of the thoracic cavity. Take a look at the figure to clearly see the thymus gland's location relative to the heart and lungs. This gland plays a vital role in the immune system by secreting thymosin, a hormone that stimulates the production and maturation of T lymphocytes. T lymphocytes are a specific type of white blood cell essential for protecting the body against infections and harmful invaders. Although the thymus is most active during childhood, it gradually reduces in size and activity as we age, making its early role in building immune defenses even more significant. In medical terminology, understanding the suffix of a word can help you determine its meaning. Let's break down some key terms related to the adrenal glands and hormones. Adrenocortical. This term ends in -al, which means pertaining to. So, adrenocortical refers to something pertaining to the adrenal cortex. Aldosterone. The suffix here is -one, meaning hormone. Aldosterone is a hormone that helps regulate electrolytes and fluid balance. Corticosteroid. Notice the suffix -oid, which means resembling. Corticosteroid refers to a substance resembling hormones produced by the adrenal cortex. Epinephrine. This term ends in -ine, meaning pertaining to. Epinephrine pertains to the hormone also known as adrenaline, essential for the body's stress response. Breaking down words into their parts, roots, prefixes, and suffixes gives you the tools to define complex medical terms with confidence. The pancreas plays a crucial role in both digestion and hormone regulation. Let's locate it first. The pancreas is situated in the abdominal cavity, near the duodenum, the first part of the small intestine. Now, let's talk about its dual function. The pancreas has two types of cells. Exocrine cells, which secrete digestive enzymes into the duodenum. Endocrine cells, found in clusters called pancreatic islets, which secrete hormones. Within the pancreatic islets, there are three distinct cell types: alpha cells, beta cells, and delta cells. Alpha cells produce glucagon, which raises blood glucose levels by signaling the liver to release stored glucose. Beta cells secrete insulin, which lowers blood glucose by helping cells absorb glucose for energy. Delta cells produce somatostatin, a hormone that inhibits the production of both insulin and glucagon, maintaining balance in the system. These hormones, glucagon, insulin, and somatostatin, work together to regulate blood sugar levels and ensure the body functions properly. This dynamic interplay highlights the pancreas's critical role in maintaining metabolic homeostasis. Here, we'll focus on distinguishing between terms that often get mixed up. Let's start with glucagon. This is a hormone produced by the pancreas that raises blood glucose levels by signaling the liver to release stored glucose. Next is gluconeogenesis, a longer term, but let's break it down. Neo means new, and genesis means creation. Gluconeogenesis refers to the formation of glucose from non-carbohydrate sources, like proteins or fats, a process the body uses when glucose is scarce. Moving on to glycogenolysis, notice the root glycogen, which is the stored form of glucose in the liver and muscles. Glycogenolysis is the process of breaking down stored glycogen into glucose to supply energy when the body needs it. Finally, we have glucose, the simplest carbohydrate and the primary source of energy for the body's cells. These terms are interconnected but distinct, each playing a critical role in the body's management of energy and blood sugar levels. Understanding the differences will help you decode medical terms with confidence. Let's review the disorders of the endocrine system. In this segment, we'll discuss the effects of hypersecretion of growth hormone and prolactin. Hypersecretion of growth hormone can lead to significant changes in the body, depending on the age of the individual. In children, excessive growth hormone causes gigantism. This leads to an overgrowth of long bones, delayed puberty, underdeveloped genitalia, and sometimes diabetes. In adults, excessive growth hormone leads to acromegaly. This condition is characterized by a protruding mandible, enlarged hands and feet, a grooved tongue, dark and coarse body hair, and increased perspiration. Now, let's discuss hypersecretion of prolactin, often caused by a prolactinoma. a benign pituitary tumor that secretes prolactin. In women, this condition can lead to galactorrhea, the production of breast milk in scanty or irregular menstrual periods. In men, prolactin hypersecretion can cause galactorrhea and impotence, affecting their reproductive and hormonal health. Understanding these conditions helps us appreciate the critical balance hormones maintain in the body and the profound effects when that balance is disrupted. In this segment, we'll explore the effects of hyposecretion of growth hormone and other pituitary disorders. Let's begin with hyposecretion of growth hormone in children, which leads to pituitary dwarfism. This condition is characterized primarily by short stature, while other aspects of physical and intellectual development remain normal. Use the figure provided to visualize the physical characteristics associated with pituitary dwarfism. Next, let's discuss panhypopituitarism. This condition occurs when there is a decrease in the production of all hormones secreted by the pituitary gland. This broad hormonal deficiency can have widespread effects on the body, impacting growth, metabolism, and reproductive functions. Finally, diabetes insipidus results from the hyposecretion of antidiuretic hormone. This condition leads to the excessive production of dilute urine, often accompanied by excessive thirst. Treatment for diabetes insipidus involves synthetic forms of antidiuretic hormone, which help restore water balance in the body and reduce excessive urine output. These conditions highlight the vital role of the pituitary gland in maintaining overall hormonal balance and the significant impact when its functions are impaired. In this segment, we'll explore thyroid disorders, focusing on their characteristics and effects. Let's start with hypothyroidism, which involves the excessive production and secretion of the thyroid hormones T3 and T4. This condition can accelerate the body's metabolism and lead to symptoms like weight loss, rapid heartbeat, and nervousness. A common cause of hypothyroidism is Graves' disease, an autoimmune disorder. It's characterized by goiter, or an enlarged thyroid gland, myxedema, or swelling of the skin and tissues, and exophthalmos, or bulging of the eyes. Thyroiditis, or inflammation of the thyroid gland, can present in three forms. Silent lymphocytic thyroiditis, marked by thyroid enlargement but no pain. Subacute thyroiditis, often following a viral upper respiratory infection, which causes hypothyroidism and an enlarged thyroid. Hashimoto disease, another autoimmune disorder, which leads to hypothyroidism, requiring replacement therapy with T3 and T4. Toxic thyroid adenoma is a single nodule in the thyroid gland that produces T3 and T4 independently of TSH stimulation. This unregulated hormone production can cause symptoms of hypothyroidism. Finally, let's discuss goiter, a visible enlargement of the thyroid gland. It can occur in both hypothyroidism and thyroiditis, highlighting the gland's response to various underlying issues. Understanding these conditions is crucial for diagnosing and treating thyroid-related disorders effectively. Now, let's shift our focus to hypothyroidism, a condition caused by a deficiency of thyroid hormone. What are the signs and symptoms? Individuals with hypothyroidism may experience dry, scaly skin, puffy face and eyes, hair loss, weight gain, constipation, a slow, hoarse voice, and an inability to tolerate cold temperatures. In its most severe form during infancy, cretinism results from inborn thyroid deficiency. This condition leads to severely retarded mental and physical growth, emphasizing the importance of early detection and treatment. Another concern with the thyroid is thyroid cancer, which typically presents as an asymptomatic nodule in the thyroid gland. Regular checkups and imaging can help detect these nodules early, even before other symptoms arise. By understanding the signs and effects of hypothyroidism and thyroid cancer, we can prioritize early intervention and better outcomes for patients. Let's clarify some similar yet distinct terms related to the thyroid gland. Antithyroid refers to a substance or medication that inhibits the production of thyroid hormones, including T3, T4, and calcitonin. These are commonly used to treat hypothyroidism. Euthyroid is an indicator of normal thyroid function. Hyperthyroid describes a state of excessive thyroid hormone production, leading to symptoms like weight loss, increased heart rate, and nervousness. Now, let's explore two key conditions associated with hypothyroidism. Goiter is the enlargement of the thyroid gland. It may be visible as a swelling in the neck. Exophthalmos is the term for protruding eyeballs, often seen in patients with Graves' disease, a form of hypothyroidism. While these terms are closely related, they highlight different aspects of thyroid function and its disorders, underscoring the importance of understanding their nuances. Let's discuss disorders related to the parathyroid glands and the thymus. Hypoparathyroidism is a condition where there is a deficiency of parathyroid hormone, or Pituitary. This can lead to low calcium levels, causing muscle cramps and spasms. On the other hand, hyperparathyroidism is an excess of Pituitary, which can result in high calcium levels, potentially causing kidney stones and bone weakness. Now, let's shift to the thymus, a vital organ for immunity. DiGeorge syndrome is a condition in which the thymus is underdeveloped, leading to a weakened immune system. Thymomas and thymic carcinomas are tumors of the thymus, with thymomas often being benign and thymic carcinomas typically malignant. Understanding these conditions highlights the critical roles these glands and organs play in calcium regulation and immune function. The adrenal cortex plays a critical role in hormone regulation, and its dysfunction can lead to a variety of conditions, categorized as either hypofunction or hyperfunction. Addison disease, which results from idiopathic atrophy of the adrenal cortex, leading to decreased corticosteroid production. Signs and symptoms of Addison disease include fatigue, weight loss, increased susceptibility to infection and stress, dehydration, hypotension, circulatory collapse. Cushing syndrome is caused by the hypersecretion of glucocorticoids by the adrenal cortex. Signs and symptoms of Cushing syndrome: obesity of the trunk, muscle wasting and weakness, osteoporosis, kidney stones, increased susceptibility to infection. A characteristic feature is the moon face, as illustrated in the text. Another condition, Conn syndrome, is caused by the hypersecretion of aldosterone. Conn syndrome symptoms include hypertension, polydipsia, or excessive thirst, polyuria, or excessive urination. Understanding these disorders and their symptoms is key to diagnosing and treating adrenal dysfunction effectively. Let's explore the adrenal gland disorders and how the body reacts to stress, a phenomenon called the stress response. Adrenogenital syndrome is caused by the hypersecretion of androgens by the adrenal cortex in women. Signs and symptoms include hirsutism, or excessive hair growth, baldness, acne, deepened voice, decreased breast size. Other signs of masculinization. Pheochromocytoma is a tumor of the adrenal medulla that causes the hypersecretion of catecholamines. Signs and symptoms of pheochromocytoma include hypertension, severe headaches, tachycardia, palpitations. Stress activates your body's fight-or-flight mechanism. The stress response begins with an alarm reaction, where catecholamines prepare your body to respond quickly. Prolonged stress can lead to numerous physical and emotional challenges, such as anxiety, irritability, headaches, fatigue, back and neck pain, lowered immunity, hypertension, heart failure, and kidney failure. To better understand the long-term effects of stress, Hans Selye developed the concept of the general adaptation syndrome, which includes the alarm reaction, where the body prepares for immediate action; the resistance stage, where the body tries to adapt to prolonged stress; the exhaustion stage, where prolonged stress depletes the body's resources, leading to health issues. Managing stress effectively is crucial to avoid the adverse effects of prolonged stress responses and to maintain overall health. In the medical field, proper pronunciation and understanding of terminology are essential. Let's review some key terms. Facies, pronounced Facies refers to a person's facial expression or facial features. Example: the patient's facies suggest discomfort, indicating a need for further evaluation. Hirsutism, pronounced hirsutism, refers to excessive body and facial hair. Example: hirsutism can be a symptom of hormonal imbalances, such as those seen in polycystic ovary syndrome, or PCOS. Virilism, pronounced virilism, refers to the development of masculine characteristics in a woman or girl. Example: virilism may occur as a result of adrenal gland disorders, such as adrenogenital syndrome. By mastering the pronunciation and usage of these terms, you'll improve your ability to communicate effectively in both clinical and academic settings. Let's explore diabetes mellitus and its related conditions. Diabetes mellitus is characterized by hyperglycemia, or high blood glucose levels, due to impaired or absent insulin production and secretion. It is classified based on dependency on supplemental insulin. Insulin-dependent diabetes mellitus, or IDDM, involves the destruction of 90% of insulin-producing cells. Non-insulin-dependent diabetes mellitus, or NIDM, is due to impaired insulin effectiveness and response. Gestational diabetes mellitus occurs during pregnancy. Maturity-onset diabetes of the young, or MODY, affects individuals in their teens and 20s. Hypoglycemia is defined as decreased blood glucose levels. Signs and symptoms include shakiness, anxiety, confusion. If untreated, hypoglycemia can lead to a coma. Treatment involves administering a beverage with high glucose or fructose content, such as 3 to 4 ounces of fruit juice, to alleviate symptoms. Let's discuss hyperglycemia, its symptoms and complications. Hyperglycemia is defined as increased blood glucose levels. It may present with the 3 Ps: polydipsia, excessive thirst; polyphagia, excessive hunger; polyuria, excessive urination. Hyperglycemia can sometimes be asymptomatic, making regular monitoring essential. Chronic hyperglycemia can cause damage to cells in the retina, nerves, and kidneys, leading to serious complications. Diabetic ketoacidosis, or DKA, results from dangerously high blood glucose levels and the buildup of ketones. It is most frequently seen in type I diabetics. Diabetic coma is a life-threatening emergency requiring immediate medical attention. Recognizing the signs and addressing hyperglycemia promptly is vital to preventing complications and maintaining overall health. Let's review the 3 classic symptoms of diabetes mellitus, commonly referred to as the 3 Ps. Polydipsia means excessive thirst. Individuals with diabetes often feel the need to drink large amounts of water. Polyphagia, defined as excessive eating or hunger. Despite consuming food, the body doesn't efficiently utilize glucose for energy. Polyuria refers to the excessive production of urine, as the body attempts to eliminate excess glucose. These symptoms are key indicators of diabetes mellitus and highlight the importance of early detection and management. Understanding the 3 Ps is fundamental in recognizing the early signs of diabetes. Let's discuss procedures and pharmacology of the endocrine system. Let's dive into the diagnostic and therapeutic procedures used to address pituitary gland disorders. Blood tests are used to measure hormone levels, such as growth hormone, prolactin, and adrenocorticotropic hormone. Urine tests assess the excretion of hormones, particularly cortisol levels. MRI and CT scans are crucial to detect tumors or structural abnormalities in the pituitary gland. Stimulation and suppression tests evaluate how well the pituitary responds to hormone signaling. Since pituitary tumors can press on the optic nerve, visual field testing may reveal related issues. Medication management are essential for treating certain endocrine diseases. Dopamine agonists are used for prolactin-secreting tumors. Hormone replacement therapy helps restore balance when hormone production is low. Surgical intervention can be used to treat specific tumors. Transsphenoidal surgery is the most common approach to remove pituitary tumors. Radiation therapy may be used when tumors are not fully removed or respond poorly to medication. For specific tumors, targeted therapy using targeted drugs block hormone production. Early diagnosis and treatment of pituitary gland disorders are critical to restoring hormonal balance and preventing long-term complications. Let's review the medications used to manage hormone secretion and replacement therapy for pituitary gland disorders. First, we have our medications for growth hormone-secreting tumors. Somatostatin analogs inhibit the release of growth hormone, helping to control excessive production. Pegvisomant blocks the action of growth hormone at the receptor level, effectively reducing its effects. Next, we have our medications for prolactin-secreting tumors. Cabergoline and bromocriptine are dopamine agonists that reduce prolactin secretion, addressing symptoms of prolactinoma. Lastly, we have our medications for pituitary hormone replacement therapy. For cases where pituitary hormone production is deficient, hormone replacement therapy can restore balance and support normal body functions. These medications provide targeted treatments for various pituitary disorders, helping to manage both excessive and deficient hormone activity. Let's explore the diagnostic and therapeutic procedures used to manage thyroid gland disorders. For diagnostic procedures, blood tests measure levels of thyroid hormones and thyroid-stimulating hormone. Thyroid scan uses radioactive material to assess thyroid function and structure. Biopsy extracts a small tissue sample to check for malignancies. Ultrasonography provides detailed imaging of the thyroid gland to detect abnormalities. For therapeutic procedures, radioactive iodine therapy destroys overactive thyroid tissue or thyroid cancer cells. Thyroid surgery involves removal of all or part of the thyroid gland or tissue, commonly performed for large goiters or thyroid cancer. Endoscopic thyroidectomy is a minimally invasive procedure using small incisions for thyroid removal. Laser ablation uses laser energy to reduce the size of thyroid nodules. These diagnostic tools and treatments help manage a wide range of thyroid disorders, ensuring accurate diagnoses and effective care. There are two types of thyroid medication: antithyroid and thyroid replacement. Antithyroid medications prescribed to manage hypothyroidism by reducing the production of thyroid hormones. Propylthiouracil medication is used to inhibit the production of thyroid hormones, particularly in cases of hypothyroidism or Graves' disease. Methimazole is another effective antithyroid medication and works by blocking the synthesis of thyroid hormones, helping to reduce their levels in the body. For those with hypothyroidism, thyroid replacement therapy is essential to restore normal hormone levels. L-thyroxine is a synthetic form of thyroxine, the hormone naturally produced by the thyroid gland. It helps regulate the body's energy use and metabolism. Liothyronine sodium is a synthetic form of triiodothyronine, used when a more immediate or potent thyroid hormone effect is needed. Let's break down and analyze medical terms into their components, including prefixes, roots, combining forms, and suffixes, to better understand their meanings. Isotope. Prefix: iso meaning equal. Root: tope meaning part. Definition: an isotope is a radioactive element or variant of a chemical element with equal protons but differing neutrons, used in diagnostic procedures. Isotopic. Prefix: iso meaning equal. Root: top meaning part. Suffix: ic meaning pertaining to. Definition: pertaining to or related to isotopes, often used in describing diagnostic imaging or treatment methods involving isotopes. Radioactive iodine. Prefix: radio meaning radiation or emitting radiation. Root: active meaning capable of action or activity. Root: iodine meaning a chemical element. Definition: a radioactive form of the chemical element iodine, used in medical imaging and treatments, particularly for thyroid disorders. By breaking these terms into their components, we gain a better understanding of their meanings and applications. First, let's discuss the therapeutic procedures for the parathyroid gland by supplying the patient with either agonist or antagonists, depending on the disease. For hyperparathyroidism, treatment options include calcimimetics, medications that mimic calcium to reduce parathyroid hormone levels, and vitamin D supplements to help manage calcium levels in the body and reduce symptoms. For hypoparathyroidism, treatment options include high-dose calcium and vitamin D supplements essential to maintain normal calcium levels in the blood. Another medication would include recombinant form of parathyroid hormone, which is a genetically engineered treatment to replace missing or insufficient parathyroid hormone. Now, let's discuss the therapeutic procedures for the thymus, which include stem cell transplants, surgery, and radiotherapy. Stem cell transplant is used to treat conditions like severe immune deficiencies by regenerating immune function. Surgery would be used for the removal of thymomas or thymic carcinomas to alleviate symptoms and prevent complications. Radiotherapy would target radiation treatment for thymic tumors or cancers. Let's explore the diagnostic procedures and therapeutic treatments for adrenal disorders. For congenital adrenal hyperplasia, diagnosis occurs in the fetus using amniocentesis or chorionic villus sampling to detect genetic abnormalities. For Cushing disease, you can confirm the diagnosis with saliva, urine, and cortisol tests to check hormone levels. For pheochromocytoma, it is diagnosed by measuring hormone levels in a 24-hour urine collection, as well as using CT or MRI scans to localize tumors within the tissue. For Conn syndrome, you can confirm the diagnosis with blood tests, urine analysis, as well as radiologic imaging to assess adrenal function. Now, let's review therapeutic treatments for adrenal disorders via medication, surgery, and radiotherapy. Steroid hormone replacements are used to treat deficiencies, and antihypertensive drugs help control blood pressure in conditions like pheochromocytoma or Conn syndrome. Surgical removal of adrenal tumors or hyperactive adrenal glands is performed when necessary. Targeted radiation therapy may be used for malignant adrenal tumors. These diagnostic tools and treatments are crucial for identifying and managing adrenal disorders, ensuring patients receive personalized care for optimal health. Let's dive into the various medications and hormone replacements used to treat conditions of the adrenal glands. Epinephrine is often used in emergency situations like anaphylaxis or cardiac arrest. This hormone mimics the action of adrenaline to prepare the body for fight or flight. Steroids are vital for replacing or supplementing hormones in adrenal insufficiency. They help regulate inflammation and metabolic processes. Mineralocorticoids, such as fludrocortisone, help maintain electrolyte balance and blood pressure. Glucocorticoids, such as prednisone, are used to manage inflammation and mimic cortisol to address adrenal insufficiency. Androgen medication supports androgen levels when deficient, helping maintain muscle mass, libido, and energy. Estrogen used in women experiencing hormonal imbalances or menopause to address symptoms and maintain bone density. Aromatase inhibitors reduces estrogen production and are commonly used in hormone-sensitive cancers like breast cancer. Selective estrogen receptor modulators target specific estrogen receptors to either block or activate estrogen's effects, used for conditions such as osteoporosis or certain cancers. Estrogen receptor downregulators block estrogen's action at the receptor level, often used in cancer treatments. Adrenal gland treatments require a combination of medications tailored to specific conditions, ensuring proper hormone balance and effective symptom management. Let's explore the key diagnostic tests and therapeutic treatments used for managing diabetes mellitus. To diagnose diabetes mellitus, fasting plasma glucose test must be 126 mg/dl or greater, or a random plasma glucose of 200 mg/dl or higher. The symptoms include polydipsia, polyuria, polyphagia, unexplained weight loss, fatigue, blurry vision, slow healing wounds. The treatment of diabetes mellitus is particularly involved in lifestyle changes. A healthy diet and regular exercise are foundational for managing diabetes and maintaining stable blood glucose levels. Empowering patients with knowledge about their condition, proper meal planning, and insulin use is critical for long-term success. Routine blood glucose checks help maintain levels within target ranges. Regular checks are essential for monitoring progress and making adjustments to the treatment plan. Additional blood tests would be required to monitor the body's health, including BUN, lipid panel, and hemoglobin A1c. BUN and lipid panel assess kidney and cardiovascular health. HbA1c testing measures average blood glucose levels over the past 2 to 3 months. Medication therapy includes oral medications and insulin therapy, tailored to the individual's needs and type of diabetes. Managing diabetes mellitus involves a comprehensive approach, combining diagnostics, lifestyle changes, and medical interventions to ensure optimal health outcomes. Oral hypoglycemics are an essential treatment option for type 2 diabetes mellitus. They help regulate blood glucose levels effectively and include medications such as metformin and sulfonylureas. Insulin therapy is a cornerstone in managing diabetes, particularly in type 1 and advanced type 2 cases. Insulin is categorized by its length of action: rapid acting, regular acting, intermediate acting, or long acting. It is vital to note that insulin is measured in units and is administered through subcutaneous injections. To prevent complications, patients must rotate injection sites. There are several delivery methods for insulin, including the use of syringes, pens, or a continuous subcutaneous insulin infusion system, also known as an insulin pump. These options provide flexibility in diabetes management, ensuring each patient's needs are met effectively. Understanding and effectively using medical abbreviations is crucial for clear communication in healthcare. Let's review some essential abbreviations. ACTH stands for adrenocorticotropic hormone. ADH is antidiuretic hormone. FSH refers to follicle-stimulating hormone. GA is growth hormone. H means luteinizing hormone. OT is oxytocin. PRL represents prolactin. TSH is thyroid-stimulating hormone. In diabetes care, DKA stands for diabetic ketoacidosis. HbA1c refers to glycosylated hemoglobin, which monitors blood glucose levels over the past 30 to 90 days. OGTT is the oral glucose tolerance test used to diagnose type 2 and gestational diabetes. DM is diabetes mellitus. IDDM indicates insulin-dependent diabetes mellitus. NIDM means non-insulin-dependent diabetes mellitus. MODI refers to maturity-onset diabetes of the young. Other key terms include: U is the unit measurement for insulin. ECG stands for electrocardiogram, a test to evaluate cardiac function. BUN is blood urea nitrogen, a test to assess kidney function. Mastering these abbreviations ensures accuracy and efficiency in medical practice. Understanding the differences between similar disorders is essential in medical studies. Let's compare and define a few conditions. Dwarfism is caused by an underproduction of growth hormone, resulting in short stature and developmental delays. Gigantism, on the other hand, occurs in children due to an overproduction of GH, causing excessive growth in height and body size. Acromegaly results from an overproduction of GH in adults, leading to abnormal growth in bones and soft tissues, while gigantism occurs only in children before the closure of growth plates. Let's also review some important abbreviations related to these conditions. DI stands for diabetes insipidus, which is caused by inadequate antidiuretic hormone production. This results in excessive excretion of dilute urine. IGF refers to insulin-like growth factors. These are stimulated by growth hormone and are responsible for its effects on peripheral tissues, such as promoting growth and cellular repair. Clear understanding of these terms and conditions will aid in diagnosing and managing endocrine disorders effectively. Using medical terms correctly is crucial for effective communication in healthcare, both verbally and in writing. Let's explore some key terms. Adjuvant refers to additional treatment given after the primary treatment. For example, radiation therapy can be an adjuvant treatment following surgery for cancer. Antagonist means something that has an opposing structure, agent, disease, or process. For instance, beta blockers act as antagonists to adrenaline, slowing heart rate and reducing blood pressure. Curative describes that which heals or cures. For example, antibiotics are curative in treating bacterial infections. Encourage students to create their own sentences using these terms to reinforce their understanding and application in real-world contexts.